Mr. Abdul Samad.
Chairman, this COVID crisis has certainly tested the patience and resilience of our healthcare system and, most importantly, our healthcare workers. We are also heartened to see many individuals and organizations that have stepped forward to lend support with food, care packs and others to show our appreciation to them. It was very heartening that on 5th November 2021, MOH boosted the public healthcare workers with an announcement of a monetary award of up to $4,000 in recognition of their efforts in the fight against COVID-19. In fact, this applies to those at community care organizations that deliver frontline services such as nursing homes and dialysis centers. Notwithstanding the above incentives, there were also not so nice news, whether it's social media or even mainstream, on the mental challenges faced by this group of workers within the sector. We are also not sure how many of such workers they are facing similar workplace stress and challenges. In addition, there was also quite a high number of reported resignations were recorded from healthcare staff due to the stress at workplace. Notwithstanding this reported incident, how does MOH engage the hospital's management to identify the workers that are having mental health issues or stress during these challenging times? What kind of support are they provided should any worker comes forward? For those who resign, was it our locals or foreigners who decide to return home to be with their beloved families? News of this resignation from this group of healthcare workers should not be seen as an obstacle of fellow Singaporeans or even students who may want to pursue a career in the healthcare, as friends and cousins that I know of are still contemplating over their decision in this meaningful sector. I'm appealing to government and specifically to the Minister of Health to again give out one-off bonus for this group of workers, not just confining to the earlier groups that had benefited. In fact, there are also outsourced workers such as cleaners, housekeepers, porters, technicians, and even security officers whose lives are equally exposed in hospitals, community care organizations, and also neighborhood clinics. Besides that, I'm not sure if MOH and MHA can also announce such incentives to all paramedics who have to receive and send COVID patients either from their homes or even neighborhood clinics to hospitals. This is because every worker matters. Chairman, our doctors and nurses serving fellow Singaporeans to provide treatment and care in this never-ending battling COVID crisis deserve fullest moral support in the course of their work. I call on fellow Singaporeans to continue to show support for this group of workers in the battle during this pandemic. Each simple smile and word of thanks to them will certainly help to boost their morale.